Good evening. Welcome, everyone. My name is Beth Goodrich, and I am with Healing Your Hidden Hurts. And tonight we are going to talk about postpartum depression. And so you should all have a handout. And what I have done is I have a blank piece of paper on the back of the handouts, and that way if you want to take notes, you have space to write any notes that you want to take. And also feel free to ask any questions. I'm very laid back. You can ask as many questions as you want. Feel free to get up and go to the restroom. Just whatever you need to do is fine. So we're going to go ahead and get started. As I said, this will be about postpartum depression. And this is unfortunately, this is a topic that is often not taken very seriously. So this is something that I'm really glad that we're able to talk about it this evening, so we can get the word out, get information out, and so people can get help that do need it. So what I have done throughout the presentation is I have put different links to the information that I have included in the, throughout the presentation. And so that way you can refer back to them. And if you want to see where I got a lot of the information, or just to get more information on postpartum depression. So as you will see, according to the American Psychological Association, postpartum depression, or PPD for short, is a serious mental health problem characterized by a prolonged period of emotional disturbance occurring at a time of major life change and increased responsibilities in the care of a newborn infant. PPD can have significant consequences for both the new mother and family. And I want to remember one thing to keep in mind is that we do say family, because when an individual is experiencing postpartum depression, everyone is included. The infant's included, other children are affected, the family's affected. So this really is a disease that affects the entire family. So this is something that should be taken very, very seriously, because everyone involved is affected, everyone in the family. It is estimated that 9 to 16% of postpartum women will experience PPD. And if a woman does have PPD through her first pregnancy, it is estimated that it can be as high as 40% likely that she will experience PPD in her next pregnancy. So therefore, it is really crucial that if a woman does have PPD, that she does get help, because it doesn't just go away on its own. So I think that's really important to remember. And if anything, it will continue to get worse over time, especially if she does have more children. So this is something that we really ought to pay attention to if we or someone we know is experiencing PPD. Many new moms experience the baby blues. That is very common. That is a very common term. We hear about the baby blues all the time. And so that is very, very typical. That can include mood swings. It can include crying spells. But the thing that makes the baby blues very different than postpartum depression is the baby blues fades after 2 weeks. That's what's the difference, the big difference here. So if something goes on after 2 weeks, then we're going to look at postpartum depression. So the baby blues would be something, okay, we've got a little bit of hormonal, changes going on. So that's what's going on. Plus, we're not getting sleep, things like that. So that's more just, okay, this is an adjustment because I've had a baby, but this wouldn't be considered postpartum depression. So, but if you're looking at something that is long-lasting, that's when we start looking at postpartum depression. One thing to keep in mind is when I have worked with women who have experienced postpartum depression, and this is why I included this in this slide, is it's not a character flaw or weakness. I've worked with women where they feel like, I shouldn't be experiencing this. This means I'm weak, or this means I'm a poor mother. And this doesn't mean this at all. And so it's not a character flaw. And so I think that can really discourage women from seeking help, because they see it as a sign of weakness. They therefore don't want to admit that they do have this. And as I said before, if you don't seek help for this, then it's not just going to go away on its own. So that's why it's really important to realize it's not a weakness, it's not a character flaw. This is a real illness, and people who do experience it do need to seek help. Okay. One of the things, I did break down some of the symptoms for baby blues so we can really distinguish the difference between, in a more specific level, the difference between baby blues and postpartum depression. And for baby blues, again, it needs to last only a few days or up to 2 weeks. Again, if it lasts longer than 2 weeks, that's when we're looking at postpartum depression. So, what it has is it can have mood swings, it can have anxiety, sadness, irritability, crying, decreased concentration, and trouble sleeping. So those would be symptoms. More of the baby blues. So that would be symptoms of the baby blues. Okay, postpartum depression symptoms. So this is what you need to look for, again, if we're distinguishing between the baby blues or postpartum depression symptoms. So postpartum depression symptoms, again, it lasts longer than 2 weeks, and the postpartum depression symptoms are more severe than the baby blues. So postpartum depression symptoms may include, and again, remember that I'm saying may include. It may not include all of these. So, but these are different things that it may include. It may include things such as loss of appetite, insomnia, intense irritability and anger, overwhelming fatigue. And again, when I mean overwhelming fatigue, I mean that you really cannot perform just everyday, very, very simple tasks. You just feel like being in bed and sleeping. You just have no energy. So that's really what overwhelming fatigue would mean. Loss of interest in sex, lack of joy in life. Again, that's the depression piece. Feelings of shame, guilt, or inadequacy. Feelings that you're not a good mom, you're not capable of being a mom, maybe your child would be better off without you, things like that. Severe mood swings. So maybe you're really, really happy at 1 minute, and the next minute you are angry or you're really sad. You have this overwhelming sense of sadness. And again, these are emotional mood swings that you cannot control. So you would have maybe some severe mood swings. Difficulty bonding with your baby. Maybe you don't feel an attachment to your baby. If your baby cries or is irritable and you don't feel like really comforting your baby, you just have this difficulty. Maybe taking it personally, this baby is crying and irritable because I'm not a good mom, and I'm not capable of being a mom, so kind of things like that. Then withdrawal from family and friends, so that can happen as well, that you just feel like I don't want to be around my family, I don't want to be around my friends, really isolating yourself, feeling like that, just completely withdrawing. Thoughts of harming yourself or your baby. So if you have feelings of harming yourself or your baby, that's when you must seek help immediately. If you haven't already sought help, that is the time. It is absolutely crucial that you do seek help. Or if someone has admitted that they have had feelings of harming themselves or their baby, they must seek help immediately. And again, untreated postpartum depression may last for many months or even longer. So that's why it is so crucial that if you or someone you know has PPD or you think has PPD, that you do seek help. Yes, you have a question?
Yes. About how long does postpartum depression last usually?
It really varies case by case, but that's a very good question. For those of you who did not hear, the question was, how typical, time frame does postpartum depression last? It really depends on the individual. And if they do seek help, that's when you really can combat postpartum depression. You can help them get the support they need. You can help them get the understanding they need. You can help them get the tools that they need to overcome this, and even hook them up with some other resources that can be of value. So that's a very good question, but it really does depend on the individual. Some individuals, though, if left untreated, it can actually last a lifetime. It can turn into chronic depression. So again, that's why it's so crucial to get help if you do think you do have postpartum depression. When to seek help? Again, if you're feeling depressed after the baby's birth, you may be reluctant or embarrassed to admit it. I hear this time and time again, and I cannot say this enough. If you do feel like you do need help, please seek help. Because again, this is not something that's likely to go away on its own. So it's really, really important. It's nothing to be embarrassed about. It's nothing to be ashamed of. People do get this. If it doesn't fade after 2 weeks, if you also see that the symptoms are getting worse, if you see that maybe at the beginning you were somewhat irritable, you were having maybe overwhelming fatigue, but then as time goes on, you're having maybe more severe mood swings, you're starting to feel like you're not attaching to your baby. When the symptoms exacerbate, that's when you really need to look at seeking help. If you find that it's getting worse and it's not getting better. If it makes it very difficult for you to care for your baby, that's again another time for you to seek help. Also, again, if it makes it hard for you to complete everyday tasks, you don't have any energy, you don't feel like accomplishing anything, you just want to stay in bed, you don't want to be with your baby, you don't want to be with family, you're finding yourself isolating yourself, that's a good time. And again, if you feel like you want to hurt yourself or your baby, again, seek help immediately. I cannot say that enough. That is so crucial to do that. Possible causes of postpartum depression. There's really no single cause that they're aware of postpartum depression. However, what they have determined is physical, emotional, and lifestyle factors may all play a role in postpartum depression. So that's something to keep in mind. So what would be important then is to look at your life and look at what of these things are present in my life, such as physical changes. And as we know, when you do give birth to a baby, there are a lot of changes that take place in a woman. For instance, there's a dramatic drop in hormones. So this may contribute to postpartum depression. And that's just a natural thing that does occur. Other hormones produced by your thyroid gland may also drop sharply, which can leave you feeling tired, it can leave you feeling sluggish, and it can leave you feeling depressed. Changes in your blood volume, blood pressure, immune system, and metabolism. These also can contribute to fatigue and mood swings. So those are some things to keep in mind, that when you have a baby, things change. And this does contribute to a lot of these feelings. So that is something to keep in mind, especially if you're someone who is feeling shame, who is feeling guilt, who is feeling like, I should be able to control this. These are physical changes that you cannot control. These are out of your control. So that is really something to keep in mind. The emotional factors. Obviously, when you have a baby, babies cry. They're not on your schedule. So you're sleep deprived. And that obviously contributes to feeling depressed, to feeling overwhelmed, to feeling tired. All of those things will contribute. If you have trouble, and it can keep you from being able to handle even minor problems. And again, it may make you anxious about your ability to actually care for your newborn. Another big one that I hear over and over again is women who give birth often feel so unattractive. And I hear that over and over again. But again, you have to keep in mind, you've had a baby. Your body changes. Everyone's body changes when they have a baby. And so it's just really important to remember that that is part of it. That is part of having a child. And so, again, I think women can be so hard on themselves. They may feel very unattractive. They may feel that their husbands or partners are no longer interested in them. All of these feelings can help them be more depressed, can help decrease their self-esteem. All of these things can really contribute to having PPD. So those are things to keep in mind. Lifestyle influences can also play a factor. For instance, a demanding baby. Some people have babies who sleep better. Some babies have babies that just don't sleep at all. If you have a very demanding baby who wants a lot of attention, who cries incessantly, and you try everything and nothing seems to work, that can cause women to have maybe low self-esteem, can cause them to be depressed, because again, maybe they feel very inadequate then as a mom. If they don't feel like that they're able to comfort their baby or be there for their baby or soothe their baby, that may contribute. They may feel inadequate. They may feel like, gosh, maybe my baby would be better off without me. I'm just not a good mom. What am I doing wrong? So that can be very, very challenging and can contribute to postpartum depression. If they have difficulty breastfeeding, things such as that can cause symptoms of postpartum depression. Also, one thing to keep in mind, if you have a baby, especially if your baby's demanding, and they have older siblings, so then you've got all these balls you're juggling in the air. You've got older siblings, you have a baby, you have so many things going on. A lot of the older siblings, they want mom's full attention. You're not able to do that. And again, that can create feelings of inadequacy, so that can also contribute. Financial problems. Having babies is expensive. So again, that even adds more stress to the situation. So if you're already dealing with financial problems, and then a new baby comes along, which is expensive, that just adds to the stress of having a baby again, which can lead to postpartum depression. All of those can really contribute. I think what's really important to remember, and I really can't say this enough, a possible cause would definitely be lack of support. If the woman doesn't have support from her partner, if the woman doesn't have support from her family or friends, if she feels very, very isolated, very alone, I think that's really important to keep in mind. This is a very, very difficult job, especially if she has to go back to work and she's sleep deprived and her baby is demanding, and if she has other children, that can be overwhelming, it can be stressful, it can be exhausting, which all can lead to feelings of inadequacy and depression, and then again contribute to postpartum depression. So it is really, really crucial, if you are someone or someone you know who has postpartum depression, that you do seek help, that you do seek not just help from a mental health professional, but also seek help from friends and family and loved ones who can help you. What are some possible risk factors? Well, we talked a little bit about that with the hormone changes, things like that, but we're going to get into it a little bit further now and dive down a little deeper. So what you need to do is, look at some of these things too that can be possible risk factors. For instance, if you or maybe a family member has a history of depression, so if you are someone who is already depressed, and then you're pregnant and you have a baby, especially if your baby's demanding, then that again can increase your depression and again become postpartum depression. And also, one thing to keep in mind, if you have had, as I mentioned before, postpartum depression after a previous pregnancy, if this is your second baby or a third baby and you've had postpartum depression before, what may happen is if you have a second baby or a third baby or so on, then the postpartum depression may just continue to get worse. So that's something to keep in mind. So these are all possible risks. And also, if you've experienced stressful events during the past year, it can be a lot of things, such as pregnancy complications, an illness, or a job loss. That can all cause, feelings of inadequacy, stressfulness, frustration. It can all cause things like that contribute to the postpartum depression. So those are those are just things to keep in mind, especially if it's been during the last year. Those are really things you must keep in mind. So anyway, just, especially if you've lost your job and then that contributes to financial, a situation, maybe you've had a death in the family or illnesses or things like that, those all contribute. And of course, the more stressors that you have, the more likely you are going to be, and having all of these things here, the more likely you are going to be suffering from postpartum depression. If you're having problems in your relationship with your spouse or significant other, sometimes unfortunately having a baby can just exacerbate those already present stresses or those already present problems. So that's something to keep in mind. If you're having problems in your relationship, again, you might not be getting the support from your partner, or if you're just having difficulty, wondering if you're going to be able to stay together, this all contributes. You have a weak support system. Again, I cannot say that enough. That's why it's especially crucial to seek help. Financial problems, again, we've talked about that one before. Also, this is something to really keep in mind if the pregnancy was unplanned or unwanted. Maybe it just wasn't a good time in your life. Maybe you were very young. Maybe you've lost your job. Maybe you're not in a committed relationship. All of those things can really contribute to postpartum depressions. Again, and the reason I think it's so important to remember all of these, again, it's because it's nothing to be ashamed of. It's nothing to feel guilty about. The more you have all of these things with a new baby, of course you're going to feel overwhelmed. Of course you might be depressed. Of course you might be having all these feelings. This is really very natural considering what you're all going through if you really stop and think about it. This is a lot, and especially if you have some hormonal changes. And again, if you don't get these addressed, of course you're going to have problems, and of course you're going to be depressed. That's just a natural response to all of these situations. Then I think that's something to really keep in mind. But again, then you must really get help when you do have them. Yes?
If you do have these risk factors, that doesn't mean you're necessarily going to get the postpartum depression. There's just a chance.
Yes. But the question was, and I'm going to actually turn it back to the risk factors. So the question was, if you do have all of these risk factors, does this necessarily mean that you are going to get postpartum depression? And the answer is no. Obviously, the more risk factors that you do have, the more likely you would be having postpartum depression. So the more likely, but that doesn't mean that you're necessarily going to get them. If we go back and we look at, if you start getting an improved support system, or if some of these things start kind of getting off of your plate, all of that would help. But again, if this all continues, and you also have the hormonal changes, if you have depression already or depression in your family, things like that, if you've had postpartum depression in the past, then again, you're more likely to get it. But this doesn't necessarily mean that you are going to get it. Good question. So I think one thing that we really need to spend some time addressing is how babies and children are impacted. Because I think what happens is, as I've said earlier, we have women who are impacted, and I think we often forget that babies, children, and other family members are also impacted. And I think that's really important to remember. And so right now I'd like to spend some time on how babies and children are impacted. Some of the things that can happen are things such as behavioral problems. So children of depressed mothers, they're much more likely to develop behavioral problems down the line. This can include sleep problems, temper tantrums, aggression, and hyperactivity. Also, you might see delays in cognitive development. Development is often delayed in babies and children who have depressed mothers. They may learn to walk, talk later than other children. They may also have many other learning difficulties, including problems in schools. And a lot of the cognitive delays may actually occur because the mother really isn't able to bond or attach with her baby. So maybe she doesn't talk to her baby as much. Maybe she's not teaching the baby to walk, as soon as they should. And if she, again, doesn't have a support system or a partner in the household, then maybe she's the only caregiver. So there's no one there who is consistently around the baby to teach the baby those things. So then you often see delays. So these are something to keep in mind. Social problems. Children of depressed mothers have difficulty establishing secure relationships. They may find it hard to make friends in school. They may be socially withdrawn, or they may act out in destructive ways. Again, it goes back to that bonding and how mothers aren't able with postpartum depression to attach to their children. They just have a difficulty bonding with their children. They may not feel that maternal instinct with their babies, so they spend less time with them. Maybe they feel, again, if the baby is crying and they pick up the baby and the baby continues to cry, oh my gosh, Maybe I'm doing more harm than good, so they stay away from the baby. So this is why a lot of times these things can happen. Emotional problems. Studies have shown that children of depressed mothers have lower self-esteem, are more anxious and fearful, are more passive, and are less independent. And again, we go back to that bonding factor. And so they could have low self-esteem because if your mother isn't able to bond with you, if your mother isn't able to properly attach to you, you take that and you internalize it. And then you say, what's wrong with me? Even though it's really nothing wrong with the baby, that's what they start to think as they grow up. What is wrong with me? And so they often isolate themselves and have a difficult time then really bonding and connecting with other children and with other people. And their self-esteem then is affected. Depression. The risk of developing major depression early in life is particularly high for the children of mothers with postpartum depression. So again, if the mother has postpartum depression and she does not get it treated, this continues to go on, then the babies, as they get older, are more likely to develop depression themselves. So that's important to remember. I think these are all really key things that we really need to remember. And we need to remember that it's not just the woman that is affected. So if the woman does not seek treatment, then her baby will grow up and may have some of these characteristics. So I think that's why it's especially crucial that women get help. And if they don't want to get help for themselves, if they're embarrassed, if they're in shame, they feel guilty, it's really important then to keep all of these in mind. So if they're not getting help for themselves, then they need to make sure that they at least get help for their babies and children. We talked just a little bit about attachment. I'm going to spend just a little bit more time about this. Mothers with postpartum depression interact less. I've kind of talked a little bit about this with their babies and are less likely to breastfeed. They're less likely to play with and read to their children. They also may be inconsistent in the way they care for their newborns. So this can be very disturbing because what can happen is a baby, if a baby cries, they cry for a reason. Maybe they cry because they're lonely. Maybe they cry because they need their diaper changed, or they're hungry, or they're scared. But what can happen then is if you're a woman who's experiencing postpartum depression and you respond very consistently, the baby feels very insecure about their surrounding. And they don't really know, okay, if I cry, am I going to get help? Am I going to get soothed? Am I not going to get help? So they can really see the world as a very unsafe place or a very unsure place. And that's, again, where that anxiety can come in, that feelings of low self-esteem, those feelings of insecurity. That's where that can start. Depressed mothers can be loving and attentive at times. So it's not that like they're always this way. They can be very loving and attentive. But at other times they may react negatively or they may not respond at all. So again, it's very difficult to see the world as a very safe place if your mom responds very inconsistently or your primary caregiver. We need to have stability. We need to have that security and that support. And if it's very sporadic, it's very difficult to really see the world as truly a safe, secure place. So this inconsistency really disrupts the bonding process between mother and child. As you can imagine, it's very difficult to really have a good bonding experience and good attachment if she's not breastfeeding and if she's being very inconsistent with the care of her baby. That's really important to keep in mind. So the emotional bonding process known as attachment is the most important task of infancy. That's the most important task. So if she's not doing this consistently, this really affects the bonding attachment process. So this is really crucial to keep in mind. Again, that's why, and I'm going to keep repeating myself, but that's because it's so important. That's why if you or someone you do know experiencing PPD, it's so crucial to get help. Again, if not for yourself, but for your baby. It's so crucial. Bonding is absolutely critical for children. Okay, a little bit more about attachment. A secure attachment is actually formed when the mother responds warmly, consistently to her baby's physical and emotional needs. So when the baby cries, the mother quickly soothes him or her. If the baby laughs or smiles, the mother responds in kind. In essence, the mother and child are in sync. They recognize and respond to each other's signals. That's why it is so crucial to be able to have that bonding process. A depressed mother is less likely to pick up and respond to her baby's cues, such as the laughter, the crying, things like that. This sets the stage for an insecure attachment. This puts the child at risk for multiple developmental difficulties and delays, including the behavioral, emotional, and social problems. So unfortunately, and people don't always really understand this, but unfortunately, if a baby doesn't really attach to their mother, this really does cause problems later in life and just carries throughout with them. So this is why it is so crucial to have that good attachment process with the mom, the baby and the mom. That is so, so important. Okay, so what if you are someone you know has PPD symptoms? What do you do? Well, again, this generally isn't a condition that you just think, okay, it's just going to go away, I'm going to ignore it, it'll pass. Again, that's the baby blues. If it lasts longer than 2 weeks, if you have the symptoms that are severe, if you have those multiple symptoms, even if you're not sure, that's the time when you do want to seek help. So if you feel like you do have that, again, seek help. But there are some things that you can do along with your treatment, that you can do outside of your treatment, that can help with your postpartum depression symptoms. One of them is making healthy lifestyle choices. This can include physical activity. This can be walking, can be riding a bike, going to the gym and lifting weights, just whatever your physical activity is of choice. I always tell people, pick something that you really like, because if you do something you don't really like, if you take up running and you really hate to run, you're not going to stick with it. So find something that you really like and try to stick with it. Maybe because you have this baby, you're not able to do a whole lot. But even if you can take your baby, if the weather's nice, for a walk, something like that. Or again, get your social network involved. Work on building that up so that you have a little time to take care of yourself and take time for some physical activity. Or maybe it's something that you go and spend time with other people doing something physical, such as riding bikes or going to the gym. Or if they have infants and babies, you can do that as a group. Again, you're building up your support system, plus you're also getting physical activity. Another thing is, it's important to eat healthy foods. And I know we say this, but it really is true. It really can help with your feelings of depression. So make those healthy eating choices. That's really important. When we're new moms and you just want to grab something real quick because you're tired, you're stressed, and you just think, oh, I just need something simple and easy. Keep some food around that you can grab really quickly. Maybe if you want a snack, you grab an apple rather than a cookie, something like that. That's really simple and easy. So try to keep some really healthy food around that's easy to make really quickly or just to grab quickly. That's really important. Also, it would be important to avoid alcohol. And for those that you don't know, alcohol is a depressant. So if we're already feeling depressed and we're drinking alcohol, that's just going to worsen the effects. So that's going to be really important to stay away from alcohol if you're already feeling depressed. This is a really, really important one, setting realistic expectations. Because I think so many times women expect to have a baby, they're going to be so happy, and everything's going to be great, it's going to be wonderful, and then when they have the baby and then they become sleep deprived and they're just overwhelmed, they just feel like a failure, when in essence that's part of being a new mom. So just setting realistic expectations can be so crucial. I had a friend one time, and after she had a baby, she told me, she said, I wish someone had told me that I wouldn't be sleeping for the first 3 months after my baby was born. I wouldn't get any sleep. I wish somebody would have told me that. She said, that would have really helped me out a lot, because I thought, what is wrong with my baby? How come my baby's not sleeping? What's wrong with me? And she said, if somebody just would have told me that, it would have been so much better. So setting realistic expectations. And again, prioritizing things. If your baby's crying, dusting the furniture or doing something like that can wait. Prioritizing, setting those priorities. And again, setting realistic expectations. That's so important. Making time for yourself. I find this a lot, not just with newborn mothers, but women in general. Women in general can be caretakers as a whole anyway. And so they always put themselves, it seems, on the back burner. You may not have a lot of time to take care of yourself, but it can be as simple as taking a bubble bath. It can be simple as reading a book for a little bit. Again, it can be simple as calling a friend. It doesn't have to be that we spend hours and hours, but if we can kind of think of things that we enjoy, especially if they're things that relax us or bring down our stress level, if we can kind of think of those things, those are really important. So if we can take time for ourselves, no matter how little, how big that is, that's really important. I think something else too, I know this sounds maybe a little silly, but getting dressed, getting in some clothes that you feel good about yourself in, leaving the house. If we just stay in our sweats or our pajamas all day and we just sit around the house, we are more likely going to be depressed. We need to get out. We need to get dressed and feel like we're being productive for the day. So I think that's really important. It can be visiting a friend, even if it's running an errand. All of that does help a little bit. So I think all of those things can make a difference. I think also scheduling some time alone with your partner. That can also be really important. I think date nights are so crucial. So if you do have a partner, I think that's really important. Finding maybe somebody in your family that you can trust, or if you have somebody in your family, it can be maybe finding a good babysitter, just something like that, someone that you can trust to leave your baby with when you feel comfortable with that, to take a date night, to get out a little bit. I think that's really, really important, because you can feel so overwhelmed and you can get into the habit of, okay, I'm so overwhelmed, I'm so tired, I don't want to go out, I just want to stay home, I just want to stay in sweats, but that really contributes to our feelings of depression. So that's really important to keep in mind. The more we can just get up, get out, and do something fun, the better. What if you or someone you know has PPD symptoms? Again, these are some more things. Respond positively. I think that's really important. So whether it's you or someone you know that you feel like has PPD, make sure you do respond as positively as you can. You may not feel like it, that you do want to respond that way, but I think that's really important. So I think what you can do is you can change the way you think and behave in responses. So I think that's really important to remember. I always tell people, think about what you can control in your life. Because sometimes maybe we're feeling like we're completely out of control. You may not be able to control that you have a crying child all the time, but maybe you can control other things. You can control getting a support system. You can control getting dressed for the day. What are things that you can control? You can control eating healthy. What are things that you can control? I think that's really important to keep in mind, and changing your response to things. Changing your response rather than thinking, my baby's crying because I'm a really bad mom. Maybe your baby's crying because they're hungry. Maybe they're just really tired. Maybe it's something else. Because a lot of times when women do have PPD, they take those things very, very personally, and often they're not. So I think that's really important to remember is, think about what you can control and really thinking about what's really going on. Because their baby cries because they want something, they need something, they want attention. It's not because you're a bad mom. So I think that's all important to remember. Again, we talked about this a little before, but avoiding isolation, that's so important. When we're depressed, our first instinct is to just stay in our sweats, stay in bed, put the covers over our head, and just call it a day. I mean, that's a lot of times our response. So I think that that's really important to remember that's only going to hurt the depression. So it's really important, even if we don't feel like it, make ourselves get up, make ourselves get dressed, make ourselves think, okay, I'm going to leave the house for a little bit today, even if I don't feel like it. Because often if you do that, you do find then that you really do feel better if you just make yourself do that. And again, remember the best way to take care of your baby is to take care of yourself. And I think that's so crucial to remember. It goes back to women taking care of themselves. It is so crucial. In order to be a really good mom, you really have to take care of yourself, and keep that in mind. So how can family and friends help? Well, I think the first is to recognize the symptoms of a new mom. You know, if you find that they are, you know, really feeling depressed, you feel like they are, if they're all of a sudden you notice they're isolating themselves, if you notice that maybe they're not calling you as much if you're a friend or family member, they feel really down or they sound really down when you're talking to them, all of those things can be warning signs. So that's really important to just keep that in mind. And then talk to her about it. Don't just ignore it and say, oh, you know, it's going to go away, it's all right. Because again, as we've learned, postpartum depression generally does not go away on its own. They really need to seek help. So then encouraging her to seek professional help, talk to someone, get help. Maybe she needs to be on medication, you know, looking at different options, things like that, seeking counseling, all of those things. Some things too to kind of keep in mind is sometimes, as I mentioned previously in the training, that women can actually have, you know, different hormonal changes, things like that, or thyroid changes. So it can also be good to rule out those things. Make sure that there's not a thyroid problem or something of that nature. But it's really important if you do notice somebody that is having these symptoms to really encourage them to seek help. And again, if they don't want to seek help for themselves, encourage them to seek help for their baby. It's so important because a lot of times women will not seek help for themselves, but if you really can talk to them about how crucial it is for a baby to be able to attach to their mom and how postpartum depression can interfere with that, then maybe they'll be more inclined to get help. So really focusing on that is that, you know, doing it not just for them because they're worth it, but if they won't do it for them, do it for their babies and their other children and family members. Treatment modalities. So what we mean by that is if you are a woman or someone you know is having postpartum depression, what are things that can be done in order to best treat them? So group therapy is one thing that can be done. And you can have groups for postpartum depression. And there are some real advantages to group therapy. Some of these advantages are they can provide an emotional, social support for women who are undergoing similar experiences. Often again, if they are isolating themselves, especially, they can feel that nobody else understands. Nobody else is going through what I'm going through. They can feel very isolated. They don't have anyone to talk to who truly understands them. Or maybe they're talking to friends or family who are just saying, it'll pass, it's okay, you know, downplaying it, things like that. Maybe they have very good intentions, but obviously that just hurts the situation. But if they can get into a group, then they can talk to people who are really experiencing what they're experiencing. So they can validate their feelings and offer that support. It's a great way to make friends too. It's a great way to increase your social support. It's also a great place to learn about PPD. Maybe they don't really understand what it is and all of the things that we've talked about previously. So group therapy can be a great place to learn about all of those things. It can also teach a variety of skills. A lot of times group therapy does give homework assignments, so they're not just meeting during that one time, but they're also really putting into place the tools that they've learned in their group therapy experience, so they can practice those at home, and that can also help. It can also provide resources in the community. If there's somebody, again, who is especially maybe isolated themselves, maybe they can even hook them up with other resources. Maybe it can be something like if they want to become more physically active, they can hook them up with a gym, or maybe a place of worship, things like that. Maybe it's just places where they can connect them with. So again, the better their support system is, the better they will be able to recover from this. Any questions so far? Okay. The group therapy can be very, very beneficial. Family and marital therapy. Family and marital therapy, again, as I've said before, this is an illness that really does affect everyone included in the household. This really does impact everybody. So often what can happen is if the individual is married or has a partner, that relationship can suffer. So this can be really important. This can also be really important in family or marital therapy because maybe the other children are obviously being impacted. So they can also get some support. And I think what everyone can do too, if you have family therapy, everyone can come together and they can determine what they can do in order to help the situation. What can we do to come together? Because what you don't want is for PPD to pull everyone apart, because that can happen. You don't want it to cause a wedge between the woman and her partner or her children. This is really important that they can come together and stay strong as a family. So again, it can provide educational purposes for what PPD really is. Maybe she has a partner who's dismissing it or feels like she's exaggerating. So this cannot just educate her, but can also educate her partner and the other family members. It can also help with insight into how they play a role. And as I said before, and what they can do. How can they adapt their roles to this new situation? How can they help? Maybe they can be supportive. Maybe they can change their roles. Maybe if the woman she's trying to be a new mom, she's trying to take care of the entire house. Maybe she's doing the cooking and the cleaning and all the shopping and everything. So maybe people can adapt their roles so that they can better help her so she doesn't feel like all of the weight is on her shoulders. It can also help the new parents, especially if this is their first child, adapt to the demands of marriage, baby, and the family. Because again, we talk about a transition. This can really help them with that transition. It also can teach techniques the couple and her family can practice in session and at home. Again, often if you have marriage and family therapy, they will give homework assignments and they will teach them skills they can practice at home. Because obviously if you're just in counseling for a week, or for 1 hour in that week, what about the rest of the time? What you want to do is teach them skills, give them homework that they can practice throughout the entire time, so they're not just giving help for 1 hour, they're really putting everything into practice to really change their life. Individual therapy. Some people that I've worked with, they just aren't interested in group therapy, and that's okay. Maybe they're embarrassed, maybe they are more of an introvert. They just don't want to share their feelings with other people. It's just beyond their comfort level, and that's okay. So a really good option, especially for people like this, or this can also be added to group therapy, is individual therapy. This is great for somebody who just wants one-on-one. There's some real advantages to individual therapy. Again, you can offer personalized care, so you can adapt really what you're doing to the specific individual. Some individuals really like homework assignments, some don't. So you can kind of adapt that when you're working with somebody individually. So that is the one really nice thing about individual therapy. You really get personalized care. And again, and I know I've repeated myself through all these, but again, it still provides education about PPD. So she's still able to learn about PPD, because education is so critical here. If she really can see that it's not just a flaw that I have, because it's not. If she can really understand that, now I get this. Okay, this kind of makes sense. I don't like it, but it makes sense at least. That can be really validating to really understand that. It also offers scheduling flexibility. So that can be really important. She's not having to deal with, okay, this is the group night that really doesn't work the best for me. Can I get a sitter if I don't have someone else to take care of my baby? So this really offers very good, flexibility in the scheduling. It can also just add, provide needed assistance to manage the demands of motherhood. Again, that one-on-one care that she's getting. Okay, let's see. So I know we've got about a half an hour. So what I'd like to do is talk a little bit about a case study. And what I like to do is just kind of share about someone that I have worked with who has experienced postpartum depression and tell you just a little bit about her and her own experience. I worked with somebody a few years back, and she actually had a couple of children already, that she had another baby, and she had already, looking back when she did end up coming to me, realized that she had been dealing with postpartum depression for quite some time because her babies were very close together in age. And so I'm going to call her Lisa. I always obviously protect confidentiality, so that's not her real name, but let's just say her name's Lisa. So Lisa came to me, and Lisa was referred by a friend. And Lisa was just feeling down. Her self-esteem was so low. She'd had 3 babies, they're all close in age, and she just didn't want to get out of bed. She didn't feel like doing anything. She wouldn't fix herself up. She just, putting a brush through her hair just felt like such an effort for her. And she came to me, and what I'd found in talking to Lisa is, and again, every situation is different, but Lisa had grown up with a mother who really never attached with her. Her mother was a very emotionally distant, and her mom actually had been emotionally and verbally abusive to her. So as she told me, she said, I don't know how to be a mom. So she already felt very inadequate. She said, my kids didn't come with instructions. I don't know how to be a mom. And so she was just desperate to learn. And so in talking with Lisa, I also realized that she had a lot of shame. She was embarrassed, and she didn't really want to talk to her husband about it because she felt like a failure. She felt like she should be thrilled all the time and just this happy mom, and it didn't matter if she'd only had a couple hours of sleep. She should just be able to bounce back and be okay. So she didn't want to tell her husband about all of this. So she really tried her best to hide this. And of course, it just gotten worse and worse and worse, unfortunately. She was really suffering. And by the time that she had her 3rd baby, she was just miserable. She was so depressed. But it was really to the point where her husband at the time, he didn't know what to do. He didn't know what was wrong. She didn't want to talk to him about it because, again, she was so afraid that he would just reject her and that he would feel like she was an inadequate mom, an inadequate wife. So she really didn't want to share all of her feelings, with him. So in working with Lisa, one of the things that I first did was educate Lisa about postpartum depression. And really, it was really enlightening for her to just put a name to it because she didn't really understand what she was all even feeling and thinking. And then it really started making a little more sense to her. Even though she wasn't real happy about it, she was like, wow, okay, this is validating though, because now I at least know what I have. I at least know what's wrong with me, because she just felt like she was so alone. She was so by herself. And Lisa was one, she really wasn't a group person. So we just did individual, at least at the beginning. We did end up bringing in her husband for some sessions. So I worked with Lisa a lot about just education. And once she really felt like, okay, I really understood this. Some of the things that I worked with Lisa was her feelings of inadequacy, her low self-esteem. We really worked on that. And we started giving her skills of how she could increase her self-esteem. And so this was really amazing to start seeing this slow transformation as she really started feeling really better about herself. And once she started feeling a little better about herself, one of the things that I really kept encouraging her was to be able to ask for help when you need it. Talk about your needs. We're human. We all have our limits. You're trying to put everything on your shoulders and you can't do it. You can't do it all. And it's okay that you can't do it all. You're human. You can't. And so then one of the things that I did when Lisa finally felt comfortable with this is we did bring in her husband. And we brought in her husband for some educational purposes on his part. So he could help be supportive to Lisa. So he could really have an understanding of what was going on. And so once he really started understanding too what was really going on, and she was learning how to ask for help, and we taught him too, okay, here's some cues that Lisa gives that mean I need help. We also taught him those kind of things. So once we did that, then she didn't quite feel so overwhelmed. She had some of that help. Even though he worked full time, she knew, okay, when he was home, he could help then. And one of the things we also did was, again, she had really isolated herself from her friends. Especially, after she'd had her first baby and the postpartum depression started, she really started cutting herself off. And so one of the things that we did is really get her back involved with some of her friends. Make some of those connections again. And that also really helped her because she did have friends who were moms. So she was then able to get together, get their kids together, and that way she could have the support and that their kids could play together. It really worked out great that she was able to do that. So we had her really start working on developing her support. One of the things we also did for Lisa is because she'd really battled depression, for so long, and depression really ran in her family, is we did have her seek help from a psychiatrist in order for her to get some medical help, like such as getting medication. And that really did, once they got her on medication too, that also helped. And she wasn't breastfeeding when she started the medication, so we didn't have to worry about that. Because obviously that can be something to consider, with medications if the woman is breastfeeding. But that's something, again, that's why sometimes you also need to seek medical attention. So she did get on medication, and with some of these other things going on, you really started seeing an improvement with her. And what was so amazing for me is she started really getting the social support worked up in her life. She started really asking for help from her husband. And she started realizing her being realistic with her expectations. And once she started really understanding that, and we also did some parenting skills as well. Again, as I said, she didn't have a role model that was able to teach her parenting skills. So when I started teaching her some parenting skills, some good disciplinary skills, things like that, like timeouts for the older kids, things like that, then she started feeling more confident about being a mom. And it was really, really amazing to see her transformation. And what really I thought was wonderful is one time she came in my office, and it was kind of a surprise to me, but I was such a pleasant surprise, is she came in and she'd gotten a makeover, and she looked absolutely beautiful. And she'd gotten her hair done, and she had on makeup and a cute outfit, and usually she had come before that she'd come in sweats, and she'd come in, she barely had brushed her hair because she was depressed. And we all like running around in sweats once in a while, but she was one that she just wore her sweats, pajamas, and things because she was sad, and she didn't feel like getting ever dressed up. And she was a person too in the past who had liked to do those things. So she had been a person that, who had said to me originally she'd like to get fixed up. So this was something that she'd like to do. So this is something that I thought was really, really great, because then it made me really realize, okay, she's really starting to feel good. And what was so great is the other therapists in the agency had gotten to know Lisa. And what was really great is the other therapists, paid her lots of compliments, and she just had a big smile on her face. So it was really, really great to see that transformation. So I think what's important with, hearing about this case study is that people can be helped. I think that's what's important to remember. There's no need to feel depressed and alone. There is help out there. So I think that that's really something important to remember. And I work with Healing Your Hidden Hurts, and we are here, and we're more than happy to work with people who do need that help. So that's something to really keep in mind. Any questions? Okay. So, for closing messages, okay, going back to take warning signs seriously. I know I've said that so many times, but I cannot say that enough. It is so important to take the warning signs seriously. So please do that. If you even think you might have postpartum depression, if you're not sure, whatever, please seek help. I would rather someone seek help, and find out, okay, maybe this isn't as serious, then leave it alone, and they find, oh my gosh, I am so depressed, I can't get out of this hole, what am I going to do? So it's really important to seek help. I cannot say that enough. And again, if it's left untreated, it can have serious, long-lasting effects on the woman, the infant, and the entire family. And I actually had worked with someone, and she confided in me that she had had postpartum depression, and she never got help. Her children are now in college, and she said that she has dealt with chronic depression now all of her life. Postpartum depression left untreated can turn into chronic depression. So that's why it's so important to get help, so that it doesn't lead to something like that, or it doesn't lead to something like where she feels like she wants to hurt herself or the baby. It's so important to seek help when you really start seeing the symptoms initially, so it doesn't lead to that. That's so important. So again, anybody have any questions? Well, thank you very much. Again, if you do have questions, please call Healing Your Hidden Hurts. All of our contact information is on your handout on the initial slide. So please give us a call if you have any questions, or if you need further help. If you or someone you know does have postpartum depression, or any other type of depression, or just has any questions at all, please feel free to call us. We're here to help. Thank you.